four types of dentin. First is primary, then secondary, then tertiary, and then predentin. The order is from outermost to the innermost. That means this is present more towards the pulp and this is present more towards the DEJ or the dentino-enamel junction. First, we will look at primary dentin. So, primary dentin are again divided into two types. First is the mantle dentin and the second is the circumpulpal dentin. So mantle dentin is this light yellow color and the circumpulpal is the darker color dentin. Okay, just for representation. So basically mantle dentin is the first form dentin. That means the first layer of dentin that is laid out is the mantle dentin. And naturally if this is the first layer, so it will be just below the DEJ. This is the enamel, this is the dentin, and this here is the DEJ. So the dentin present just below the DEJ is the mantle dentin. Now the fibers that we have here, the collagen fibers, they are of larger diameter. These are approximately 20 nanometer in diameter. So these are larger diameter collagen fibers and they are present perpendicular to the DEJ. The fibers are perpendicular and these fibers are called von Kropf fibers. The other important thing is it is less mineralized as compared to circumpulpal dentin. It is also soft and provides cushioning effect circumpulpal dentin. So this actually provides the bulk of the dentin. Okay, one important thing is the primary dentin forms just before the root completion. मतलब जब तक पूरी रूट नहीं बन जाती उस समय तक जितना भी डेंटिन बन रहा है that is the primary dentin. Forms before root completion. रूट कंप्लीट होने के बाद जो डेंटिन बन रहा है that we will study later. Pulpal dentin forms the bulk of the dentin. It is more mineralized as compared to the mantle dentin and it has smaller diameter collagen bundles. So let's zoom this also. So this one is more mineralized and the collagen fibers are of smaller diameter and they are more closely packed. You can see these are more closely packed. Please note that here the root formation has been completed. So the dentin that deposits after the root completion is called the secondary dentin. Secondary dentin is a thin band of dentin that surrounds the pulp. So this is the thin band of dentin, this is the secondary dentin. The difference between primary and secondary is there are lesser number of tubules. So just imagine that these are the dentinal tubules. Now when the tubules pass from the primary to the secondary dentin, we can observe a bend in the shape of the tubules. Here there is a bend in the shape of tubules. Okay, and there are comparatively lesser number of tubules in secondary dentin as compared to the primary. Since it is present outside the pulp, so it provides protection to the pulp in older teeth. And the deposition of secondary dentin is much slower as compared to the primary dentin. That means the rate of deposition is slower here. Dentin. It is also called reparative response or reactive dentin because it is formed in response to a stimuli or trauma. So trauma, they can be different kind. For example, caries or attrition or there is fracture. All these kind of stimuli cause the formation of tertiary dentin. These are again of two types. So there is reparative dentin and there is sclerotic dentin. The reparative dentin is formed dependent on the duration and intensity of stimuli. For example, the caries formation has begun in the tooth. So in response to these caries action, this stimuli, reparative dentin layer formation will start forming around the pulp to protect the pulp from any kind of seepage of bacteria or percolation of fluids into the pulp. So that's how the reparative dentin is formed. Next we have is the sclerotic dentin. what happens, the tubules, the dentinal tubules, they get filled with calcium salt. Okay, this is also because of the age changes. What happens in older age, there is attrition of teeth, so a lot of dentine and enamel, all of that get exposed to the external environment, and there are high chances of the percolation of fluids into the pulp. So to prevent that, we have these dentinal tubules here. So these dentinal tubules get filled with calcium salts, and it prevents any percolation of fluid into the pulp. Predentin is nothing but unmineralized dentine matrix. That means it is just the ground substance which is later going to form the actual dentine when the minerals are added into this matrix. So what happens, just imagine कि dentine formation is continuously going on over here. Okay, so we know that the dentine deposition occurs in this manner. The odontoblast deposit dentine layer by layer above them. Okay, so the deposition is happening layer by layer, and the first layer of dentine is laid down over here. This is now a ground substance. Okay, later it will be mineralized, and this will move upwards. That means a new layer of dentine will be deposited below it. Okay, so can you imagine that this pre-dentine becomes the primary dentine or the secondary dentine eventually, but the first layer that is deposited is the pre-dentine, and it lies just adjacent to the pulp. So it contains only of collagen and glycoproteins. It is thickest where there is active dentinogenesis going on. That means where there is active dentine deposition going on, the pre-dentine thickness will be maximum.